Hi, everyone, and welcome back to Birth and Beyond. So glad that you're watching today. My name is Adrianne, and I'm sharing information so that you can make informed decisions about your maternal care. But today I have a question for you, and that is, do you know where you're giving birth? And I think that question most women would answer and say, well, I'm giving birth at a hospital, right? And that is very fine, depending on who you're speaking to. That is a very okay place to give birth. But today I want to also talk about an alternative option, and that is a birth center. And so for those of you who may not be familiar with what a birth center is, essentially a birth center is a freestanding facility where it's a homey-like facility, a low-tech, no intervention facility where women who desire a natural childbirth experience typically go. Women who want to feel like they're at home, but not be at home. Birth centers are great for that. Birth centers, when it comes to your childbirth, are a great facility for women who are considered to have low risk pregnancies. At a birth center, you will not find OB doctors as the primary care physicians. The primary care physicians at birth centers are midwives. And we talked about midwives in the previous video, so go check it out just to find out what a midwife is, how they differ from a doula. Okay, and so I wanted to also just go into a little bit today the disadvantages of a birth center as well as the advantages. And then I'm also going to talk about the same thing for hospitals. Okay, so I already mentioned to you a birth center is great place if you want a home-like experience. Typically at a birth center, you have a lot of freedom as you would at home. They encourage doulas. They encourage families to stay together. There's usually not a limit to the amount of people that you can bring to your birthing experience. Totally up to you. You're usually encouraged to eat, move around. There are no epidurals, no pain medications and things like that. A lot of them offer birth tubs and showers. And from a financial standpoint, birth centers are typically less expensive than a hospital birth. Okay, so with keeping that in mind, I want to talk about the flip side of that, and that is the disadvantages of having a birth at a birth center. So I mentioned that, you don't have the option for an epidural or pain medication, right? So a disadvantage for some could be the fact that you don't have that option. Some women might get to the point and say, you know what? I thought I wanted this, but no, I need an epidural. I need my pain medication. If you're not at a birth center, if you're not at a hospital, you're not going to get that. In the event that there's an emergency with you or your baby, you would need to be transferred to a hospital if you are at a birth center. Due to that, there's no access to an operating room there. And from the financial aspect of things, you have to find out from your insurance company if they will cover your birth center birth. And also call over to the different birth centers to find out what insurances they do take. Your insurance company may or may not cover it, but it's totally worth looking into to find out. And lastly, a disadvantage that was an advantage for a birth center for some is that their discharge time is within 4 to 24 hours. You birthing at a birth center, you're not going to be there that long after you deliver. So that's something to keep in mind as well. Now I want to talk about hospital birth. So there are advantages of hospital births for some. I just also want to add, you'll talk to some individuals who have strong opinions about hospital births, and that is fine. It's really important for us to know what we want, why we want it, so that we can then choose what options are best for us. So while for some, a hospital birth is like a no-no because of just the values that they hold and what they want from their childbirth experience, for others, it might be the best place to be. So, the advantages of a hospital birth is that in the case of emergency, you have an operating room, you have your epidurals, you have your pain medications, you have all those clinical interventions readily available to you. If something goes down, you don't have to transfer anywhere. You're under the roof of where that can be taken care of. A lot of people feel safer at a hospital. And a great advantage, especially if you still want a midwife, is that a lot of CNMs, certified nurse midwives, practice in hospital setting. So you can still have the option of having a midwife who uses the midwifery model of care, but in a hospital setting. So that's an option as well. And most hospitals, they do allow doula support. So that's great. I'm in the Philadelphia area, and I've had the opportunity to support women at about 5 different hospitals in the city, and they've all accepted doulas. And so that's great. Now, one of the disadvantages of hospital births is that there is a limit to the number of people that can be in your birthing room. So if you hold near and dear to your heart to have all of the family experiencing your childbirth experience, a hospital setting will not allow you to do that. You won't be able to get that in that type of setting. They have really strict policies, rules, and schedules that they have to adhere to. So a lot of the freedom and things that you may experience at a birth center, you may not get that at a hospital, because they have their procedures and practices and things that, is very stringent. Typically, a lot of people may argue that at the hospital, you're at a higher risk for infections. We know that it's just the reality of things because it is a hospital setting. And so that's something to think about. For some people, hospitals can be intimidating and really impersonal, especially if you're at like a teaching hospital. There are some people, they don't want residents attending their birth. And that's a total personal and understandable choice. But depending on where you are, that might be what you get. And when it comes to the postpartum side of things, like your recovery room, you may not get a private room. So overall, you might have a less private experience at a hospital. So I want to know from you, where did you deliver your baby? Was it at a hospital? Was it at a birth center? Was it at home? And if you're pregnant or thinking about becoming pregnant, where are you thinking about delivering your baby? Was this information helpful? Is there anything that you want me to clarify? Please leave your questions, comments below. I am here to share information. Your question asking helps me learn and helps me to research and get the information that will be most useful to you. Totally appreciate you watching this video, and I will see you next time in the next video on Birth and Beyond. See you later.